Bore good morning. Welcome to the May 2021 meeting of Powys Teaching Health Board. It's a beautiful day. I can see bluebells in some of the backgrounds and wonderful lakes, lovely pictures of Powys, for which we are now famous across Wales. I will introduce the participants in a minute, but just to let you know that this is being held virtually, of course, and is being streamed live. So welcome also to anybody from the public who is watching us. So present today, I'm Vivian Harpwood, Chair of Powys Teaching Health Board, but also present are Mel Davis, Vice Chair of the Board, independent members, Ian Phillips, Mark Taylor, Susan Newport, Trish Buchan, Tony Thomas, Matthew Dorrance and Robert Lewis. Also present is the Chief Executive, Carol Shillibeer, and the following directors: Jamie Marchant, Deputy Chief Executive and Director of Planning and Performance, Alison Davis, Director of Nursing, Pete Hopgood, Director of Finance, Stuart Bourne, Director of Public Health, Kate Wright, Medical Director, Julie Rolls, Director of Workforce and Organisational Development, and Claire Masden, Director of Therapies and Health Services. Back to Jamie. I believe it's Hayley now who's taken over as Deputy. I'm sorry about that. Sorry, Hayley. In addition, we have with us Rani Mallison, the Board Secretary, Dr. Paul Buss, Programme Director for Clinical Strategy, Andrea Blaney from the Community Health Council. Unfortunately, Katie Blackburn and Francis Hunt couldn't be with us, have sent apologies. Colleagues from the Corporate Governance team will be supporting the meeting. Apologies have been received from Francis Gerard, independent member, who's unfortunately has an exam board today in the university in Cardiff. Katie Blackburn and Francis Hunt from the CHC, I've already mentioned. So I hope that that's everybody and I haven't left anyone out. Will you note, please, that participants may look away from the screen from time to time to check their notes or to look at the sidebar and put in requests to ask questions. So I'm moving now to the agenda. Are there any declarations of interest first today? No, thank you. Minutes of the previous meeting then, held on the 31st of March for approval. First of all, did anybody notice any matters that needed to be corrected in these minutes? I don't propose to go through them page by page because you've all had an opportunity to read them and check. Is there any item at all that needs to be corrected? Apart from spelling, if you notice any spellings or typos, please send details into the Board Secretary. They look pretty good to me, these clean minutes. Thank you. So can we approve these as an accurate record of the last meeting? Thank you. Are there any matters arising from these minutes that are not on the action log? No? Thank you. So can we turn to the action log, please? And I'm asking the Board Secretary to go through this for us, with us.
Thanks, Chair. So the action log has 4 actions included arising from the March board meeting. 3 actions have been marked as completed as they've transferred to committees within the board. And there's 1 action marked as not yet due, which is in relation to a discussion on workforce sustainability. And we're proposing that that's picked up through work plans, which will come back to the board at the end of June.
All right, thank you very much. Does anyone have a question about that for Board Secretary or for anybody else? Okay, thank you very much. So that means we can move on. And there are some updates from the Chair, the Vice Chair and the Chief Executive. I'll deal with my own report, which is brief. That doesn't mean to say I haven't been busy. I've had meetings every day almost, and it's a very busy time as we emerge from the COVID pandemic, of course, for anybody working as an IM, even an independent member, but also as a chair of a health board. So numerous meetings on an all Wales basis, including meetings of ethics committees, Mid Wales Joint Committee yesterday, the Welsh Risk Pool and so on. And also on a UK level, I've had a meeting of the trustees of the NHS Confederation, which I chair. But some key points really that I've drawn out: the election, the new members that we are welcoming from the Senedd. Delighted to see these new people who've been elected, and congratulations to all of them. Fortunately, the new health minister happens to be an MS for our area, Mid and West Wales, and she has been taking a particular interest in health for some time with the previous minister, Vaughan Gething, who served a tremendously long time and did such good work through the pandemic. Carol Shilabir and I are taking every opportunity to meet the new members of the Senedd, and I believe Carol has a list in her report, so I won't go into that, but we have already met with Jane Dodds, so that is a good sign. We're getting in early and meeting these new people. So I extend my thanks and very best wishes to Vaughan Gething as departing minister, and he takes over a new role as Minister for the Economy, which is probably going to be as challenging, well, no, not quite as challenging as being Health Minister. You'll see that on the paper that I've submitted to you, on the 21st of April, we had a development session to consider the effectiveness of the board committees and whether the existing structure, which hasn't been with us for that long, is still fit for purpose. We are looking forward to discussing this further as a whole board, because it is very important that we get the structure right in order to have correct governance and means of assurance in place. And we'll also be looking again at the role of board champions and the committee membership. Finally, the independent members have had appraisals with me over the last couple of months. It's been a difficult time, so these are later than would normally happen, but it's all more or less finished now. So thank you to all of them. Just one more to do. So I'll hand over now then to Mel, the Vice Chair, with her report.
Thank you. I'm just having issues unmuting there for a second. I'm not going to go through the report. I will just mention, though, that yesterday evening for 3:30 we did have the launch of the Nest development, which was the work that the Together for Children and Young People's programme board is doing, and that was a particularly enjoyable event. A lot of the work we do obviously is really necessary, but this particular event was very well attended, and particularly I'm looking forward to seeing how that work progresses going forward with the children and young people and the early intervention. So I just wanted to draw that out really, and I'll leave it there unless anybody wants to ask any questions, which I'll be quite happy to answer. Thank you.
Okay, thank you, Mel. If there are no questions, then I'll hand over to Carol Shilabir, our Chief Exec, for her to present her report.
Carol Shilabir ydw i, and I'm delighted to present the report today. Just to provide an overview of some of the areas where there'll be a little bit more detail within the main body of the board reports today, but I did just want to flag the overview of progress with the annual plan. The board members, you'll recall that you approved a draft annual plan for submission to Welsh Government at the end of March. The requirement is for refinement of those plans to be carried out during Q1 in order to submit the final report at the end of June. I'd like to say that we've done a lot of work on this, and my thanks to the directors team and their teams in supporting what is an accelerated period of planning. And in particular, I did want to flag that of the £100 million NHS Recovery Fund that the Welsh Government has announced, that we will be in receipt of approximately £2.5 million of that. So that's excellent. We are working now in terms of how we manage the deployment of that into services that can support patients. We understand that there may well be some further investments the government will wish to make over the coming months and years in terms of recovery and renewal planning. The other thing just to say on that is that we've had a number of conversations on it, which has been really fruitful in terms of with the Community Health Council in the recent board-to-board meeting, with staff briefing sessions and with the Trade Union Partnership Forum, all of which has been extremely helpful. And then I just wanted to flag there is clearly a performance report later on the agenda, but I did want to just note the position at this stage on COVID. So we are seeing a sustained lower level of cases now in Powys. We have to keep an eye on it all of the time. Small numbers do make a difference, and important to emphasise, I think, the testing and tracing service that is still there, and in fact has had to expand and adapt through the last few months in particular, and quite a focus at this stage on international travellers and supporting those people. And then just finally, the one thing I did want to flag up was the continued progress with the vaccination programme. We have at this stage now invited all adults, eligible adults over the age of 18, and there's been a fantastic response from communities to those offers, but we will be moving into a leaving no one behind focus during June alongside second doses, and we will be planning for a booster vaccination. So that's all I wanted to draw out there, Chair, and hopefully that was helpful, and we'll cover off some of the more detailed items later on in the agenda.
Thank you. Question from Trish, I think.
Good morning, Borida. It's Trish Buchan here. I really wanted to ask a question about the vaccine, and I'm sorry, I'm not very good at this. Really to comment on the pace at which we're rolling out the vaccine, and to commend the vaccine being available to our younger population. But I would also like to ask about the uptake of vaccine and our vaccine, people that are hesitant about taking the vaccine, and whether or not we're on top of where this is happening and what we're doing about it so that no one is left behind.
Yeah, thanks very much for the question, Trish. It's a really critical part of the vaccination programme is the issue of vaccine equity, and the issue, as you quite rightly flag, about hesitancy. We learn quite a lot from vaccine programmes that occur and become part and parcel of the sort of health protection offer. But I think in particular, the vaccine uptake has been tremendous. With the COVID vaccine, clearly it's been such an important element of us trying to regain some of the freedoms that we had previously. But we do know that there are some areas that have not yet sort of fully picked up vaccine. If I may, Chair, I know that Stuart Bourne or Hayley may wish to comment, because just to touch on the mechanisms that we've got in place, Trish, to follow that work up and to be particularly focused with that. So maybe Hayley will want to come in first as the senior responsible owner for this programme.
Thank you, Carol. Yes, it's really important, and I think now that we've made the offer to all eligible adults, we're really shifting. We've had a continued focus on leaving no one behind, but we're really shifting into really being focused exclusively on that, together with giving second doses. Just to give you some examples, we've got a key work stream led by Nicola Benge, Public Health, on leaving no one behind, which has got a range of stakeholder and support from various partners on the agenda. We were already doing work particularly with targeted groups, so we've been working with the homeless and trying our best to increase uptake in that case. We've also been doing a lot of analysis work. Now, we are getting further information available from the English system uploaded onto our Welsh immunisation system at the end of this week, which will give us a fuller picture of immunisation uptake across the cross-border, particularly our neighbouring GP practices. So that will be really good, because we'll be able to sort of cross-reference that work. But our team, our administrative teams, for every patient, member of the public that doesn't come to an appointment, what we do is we have a really clear process around managing people who don't attend appointments. So we contact them, and we are now going through every person that hasn't attended an appointment and calling them to speak to them about their reasons for not attending the appointment, and offering further information to inform their decision, but also helping them to make that alternative appointment. So it's a really important piece of work. Be quite keen for the board to see some of the detail of that now as we go through, and some of the impact of the work that we're doing to leave no one behind. But we are really now moving to the space where we're absolutely focused. That's where we are. But we have got excellent uptake, and it is getting harder now to persuade the last sort of stages of individuals to come in for the vaccination. But we're doing our very best by providing information and also helping to discuss with them some of the barriers that they may have to help them make an informed decision. And both Stuart and the public health team have been very supportive to help us undertake that. We've also been sharing on a national basis some examples of good practice. So we're sharing lessons learned and sort of different mechanisms across Wales through the national programme as well. Happy to provide further assurance and detail to the board and committees on the work that we're doing.
Shall I just add to that, just from a public health point of view? I think Hayley's covered it admirably. It is absolutely vital that as many people have a complete course of the COVID vaccine as possible. We know that just from some of the learning we're getting currently around the Indian variant that's dominating a lot of the news. So it is absolutely vital. It is also obviously a voluntary process, and people have the right to choose based on a complete set of the information. And that's very much the focus, I think, for the work is helping people to make as informed choices as possible for them to make the right decision for their circumstances. But Hayley's covered the multi-agency angle. We're working with community connectors, we're working with housing colleagues in the local authority, and there is really an abundance of intelligence coming through now about take-up by geography, by certain groups, and we're looking at that and mining that for intelligence about where we target our efforts. But there is a lot of work in this area, and just to hopefully provide assurance on that, it is a big focus of work, and will continue to be so as we go forward.
Thank you, Stuart and Hayley and Carol. I don't want to be hubristic about this, but I was very annoyed today when they were boasting on television in NHS England that they were getting down to age 30 when we have vaccinated our 18-year-olds. So, you know, we have done very well, and I'm using we in rather a loose way because I didn't do any vaccinating, but I know that our chief exec did. You know, our staff have worked incredibly hard to get through so many people in such a short time. And not only that, there are many members of staff who've been backfilling for the people who've been moved to deal with vaccinations. So a big thank you to all of them. Were there any more questions for Carol on her report? No? Well, thank you. Thank you very much, Carol. We'll now move to the next part of the agenda, where there are some items for approval. And agenda item 2.1 is going to be introduced by Alison Davis, our Director of Nursing, the policy on putting things right and management concerns and management of concerns. Over to you, Alison.
Diolch, Chair, and Bore da pawb. It's a pleasure to bring this paper to the table today, Chair, for Board to consider the revision to the policy on putting things right and the management of concerns, and the papers in relation to discussion and approval, please. As for some background, as you note in the paper, the existing policy for the Health Board was approved by Board in July 2019 and was extant for a 3-year period, and the focus of the policy is essentially about listening, learning and acting on concerns and complaints raised by the people who use our services or those we commission. You know, the policy is obviously a key priority for us. It's absolutely fundamental that we build on the information and the experience that our population have with us and our commissioners. And this priority has been reflected in our clinical quality framework, which gets reported regularly to the Experience, Quality and Safety Committee. And just to jog Board's memory, a concern is defined as an incident, complaint or claim, so it's fairly inclusive. The current position for our policy, the policy has been applied in practice since its inception. Last year saw some variance in its application in progress, essentially because of the COVID-19 pandemic. But Board will be aware that since late last year, there's been quite a focused delivery element to the policy, which is actually reflected in our performance report. A little bit later on, you'll see there's an improving trajectory, thankfully, in the way that we are able to manage complaints. That's been enhanced by a training programme and an audit and assurance programme that's been developed to look at our performance in that area. So bringing us on to the reason for the revision to the policy. In November 2020, the Public Service Ombudsman for Wales wrote to health boards to bring to their attention the Public Serviceman Ombudsman's Wales Act for 2019 and some of the duties within that Act. And as a result, the Complaints Standards Authority, which is a component of the Ombudsman's Office, has been doing quite a lot of targeted work to support public service bodies, including health boards, to improve on concerns and complaints handling. And you'll notice on page 3 of the report, Chair, some examples there in the way that we've been supported to do that. There's also a requirement to provide data to the Ombudsman in terms of our performance to help inform the all-use picture and to garner further improvements where those are opportune. So you'll notice, Chair, the review of the existing policy and procedures being taken in line with the requirements of the Public Service Ombudsman for Wales, and the examples in the paper identify the particular areas that have been considered. The review has identified the need to provide a more straightforward process for staff to follow. It can be quite a convoluted arena, particularly where we've got a number of provided services, and that's a piece of work that we'll be undertaking going forward. Also, the Ombudsman's offer is a really good offer, particularly in sharing with members of our population and others, key stakeholders, about our approach to managing complaints, and that's something that we'll be developing going forward also. This paper's gone to the Executive Committee and comments made there have been accommodated into the revised policy. Just a caveat, and we are grateful to bring this policy today. If it's approved by board, then we are required to share it with the Public Service Ombudsman by the end of this month. We're mindful of new and improved work that's being generated by the Delivery Unit and Welsh Government in relation to incident management across Wales. That work has recently been shared and there's a go-live date there for the middle of June. So we are cognizant that as that work progresses and phase 2 of that work in July, we are likely to bring further to the board a further revised policy for review when we understand the context and the implications for us locally fully around those changes. And that's the presentation of the report, Chair. Really grateful for board's perspective and potentially to approve the policy.
Thank you very much, Alison. Are there any questions? Ian? And yes, then Mel.
Thanks, Chair. Really comprehensive document. Thank you very much for that. I just had a couple of questions, really. Do we have any, first one is, do we have any plans to make a sort of pocket version of this in terms of the staff? That would be the first bit, because it is a comprehensive document, and to provide clarity both to staff and to patients in terms of the key principles and key steps in the process. And sorry, shall I stop there, Alison?
Yes, diolch Ian, really pertinent question. So yes, indeed, the revision of the policy has really identified the need for a more straightforward guide for staff and for others, because it can be quite convoluted. So that's an undertaking that we are taking forward at the moment. Additionally, the documentation provided by the Public Service Ombudsman for Wales is really excellent, and actually gives a really good external facing opportunity for us to develop something for our public. And we're looking to develop a charter that demonstrates some of the key principles that we can share widely to enable both of those, everybody's a stakeholder in this, to enable both those elements to be as visible and as useful as possible.
Thank you, Alison. And the second question was actually, you've teed up for me quite nicely, because it was in respect of the Ombudsman documents, which I was really impressed with in terms of the clarity and brevity of those documents. And in terms of specifically on our policy, which is, I'm referring to Appendix 5, page 11, section 2.2. Don't worry, you don't need to know the detail of that, but just so the folk are clear, where it talks about providing staff involved in complaints will be given support. And reading the Ombudsman document, I think I read that it talked about treating staff involved equally rather than giving them support. And I just wondered whether we should reflect on the fact that we might want to strengthen that in terms of treating them equally. Sounds like a stronger sentence than giving support.
Oh, thank you. That's a really constructive comment, and we'll certainly take that on board. And the policy probably needs to reflect better the practice, Ian. So that's very helpful. As mentioned, we'll need to bring a revised policy back for board consideration at a later date in the year. So if you're acceptable to that, we can certainly develop that paragraph in readiness for that time.
Thank you, Alison.
Thank you. Mel was next, I think. Was that satisfying your questions, Ian? I think so. I get in the sense.
Absolutely.
Right. Thank you. So Mel, you were next, I think.
I was really just going to, Ian's covered part of it with the comments from the Ombudsman's report and how they were reflected in the policy. But I just sort of also about the strengthening of the process for us as a board, and how this will reflect and go through from the Experience and Quality and Safety Committee. So how we're sort of strengthening our position to be able to support people all the time. So I'm just really wanting to congratulate you on the piece of work. I know that it's a revised one, but it will strengthen and enable us to see where our issues are all the time. So, I mean, really, that was all I needed to say, really, I suppose. I just sort of, that continual improving, and from our board's point of view, I just wanted to offer my congratulations. I'm obviously in support of it, so thank you, Alison. But again, I think the Ombudsman was very clear in how we're setting ourselves out, and I think that will put us in a good position. So thank you.
Thank you.
Thank you. Robert, you had a question as well.
Yes, thank you. Well, I'd like to add my congratulations as well. It's actually quite a complicated area, isn't it? Because if you try to simplify things too much, then you end up, giving people the wrong impression. So it's quite a challenge. But I've got two questions really, and I'm afraid I can't see the document in front of me, because if I try and put that on the big screen, then the sound goes. So, but the first point was that somewhere in the document you referred to the Quality and Engagement Act 2020 and the duty of quality and candour. And I just wondered whether you think this will actually substantially affect our approach and the document when that is implemented in April 23, because previously as an outsider, I would say that there is in effect a duty of quality manifested in numerous other processes and documents anyway. And although candour is not the same as transparency, I think there's a little bit of an overlap there. So I just wondered whether you think that when that's introduced in April 23, it will actually alter things very much. That's my first question.
Thank you very much indeed, Robert, and a really insightful question. I guess I'm going back to your first comment about oversimplification and elements can be lost if that's the case. Actually, I think if we go back to basics and think, what are we trying to achieve with any policy, guideline, protocol or other element of direction, we all want to ensure that we are able to provide safe, quality, effective services, and that the people who are party to them, whether designing or receiving them, are able to influence and raise concerns. So I think anything that we can bring together as a collective to support that quality agenda is going to make a difference and make a positive difference. Obviously, in terms of the Act, we'll expect some statutory guidance at some point in terms of its implementation, and I would imagine it'll create some change in terms of focus of reporting, data and intelligence, methods of reporting, and the way that that's triangulated and influences service delivery. So in short, to answer to your question, yes, I imagine it will make a difference. We'll continue on our journey of improvement and revise and polish as we go along, and welcome, I think, the positive implications of the Act.
Right, thank you. And the second question is about the end of section 6.0, which is the section on unreasonable or abusive complaint behaviour. And at the very end of that, we say that our response to these situations will be dependent on the individual circumstances. Agree with all of that. But I just wondered if we might consider an extra sentence at the end, which is along the lines of, nevertheless, in these circumstances, we will endeavour to take necessary steps to establish the significance and the validity of any complaints or concerns, because of course it's possible for and perhaps likely that in many cases there is a prima facie case, even though the way that the person is addressing it and delivering it might be unacceptable. So I just wondered if, because you could read that in a couple of ways, if you wanted to, you could read it that abusive behaviour of itself would mean that we wouldn't have to follow anything up, and I just wanted to provide that sort of reassurance. It's just something to think about, not necessarily to discuss now, but as this thing evolves.
Thank you, Robert, and a really key point, and I think that reflects back in a similar way to the point Ian made earlier, because in practice that is exactly what we would do. We would never rule out anybody's concern or complaint, purely based on their presentation. We would always endeavour to help manage that in the most constructive way, whilst balancing obviously the need to enable and staff within that arena as well. So if you're agreeable, we can certainly develop that on the end of section 6 and perhaps demonstrate that when we need to bring the policy next back for revision, which is likely to be later this year.
Thank you, Chair, and thank you, Alison.
Thank you.
Yes, Carol, did you want to come in on that at all? It's a very important policy.
Yeah, thanks, Chair. I think Alison has presented it very comprehensively, and just to underline the last point, really, absolutely, we get people raising concerns often when they are stressed, frustrated, worried, and so the concerns are the prima facie, as you say, matter that we will deal with. It is only after significantly repeated difficulty would we ever get to that section, Robert. So anyone who might be thinking about making a complaint, I would be very open and say, please do, because actually it helps us to learn. This is about, we will, you know, and Alison described this earlier, we will listen, we will learn, we will act. That is the cultural and practical application of this policy, which is why it is a policy that is retained for the board, and it is so significant. So this area is developing quite a lot at the moment, not only around the new legislation, but around continuing practice development. So it is good that we're reviewing it again now, and probably a bit later in the year as well. It just to keep this as a key focus for us as a board. Thanks, Chair.
Thank you. Thank you, Robert. Your first point actually is something that's been on my mind for quite a long time, ever since the legislation was introduced on the duty of quality. So it's a question that's, well, I actually, when I responded to the consultation on that, I raised myself. So it'll be interesting to see how that develops. Thank you. Are there any more questions now on this before we go on to consider whether we approve?
Yes, Chair,
yeah.
If I may, it's
Right.
Trish back in again.
Yes.
I'd like to thank Alison for this and support the adoption of it. I think it is important that we continuously review and improve, so I look forward to seeing the next version of this. I was particularly pleased in the policy to see a reflection of our responsibility in terms of the services that we commission for our patients. And I do think that when we live in Powys, we don't often understand how unique our situation is, in that most of our secondary care services are commissioned outside of Powys. And I think that is unique, and it can be complicated when there's a complaint to be made or an issue that needs to be investigated. And I'm hoping that we can provide better signposting in future as we go forward as to how our patients can and our population can raise issues with us. But thank you very much for the paper, and greatly appreciated.
Yes, thank you, Alison. And also, I was very pleased to see the organisational development framework, the guiding principles there, which echo so strongly prudent healthcare, because it's all part of doing the best we can for our patients and our staff as well. So thank you very much. Can we move then to first of all, approve the revised interim policy on putting things right and management of concerns. And this has to be submitted to the Ombudsman by the 31st of this month. Are you all happy to approve? Thank you very much. Thank you, everyone. And also we note the need for continued review. We've discussed that just now, to take account of finalised policy documents to be issued at national level. And then we support, I believe from the conversation, the work in progress to develop a simplified process to support staff in managing complaints. And finally, support the work in progress to develop guidance or a charter for Powys residents. I'm much in favour of a charter, and their families, clearly setting out what they can expect from the health board when they raise a complaint. Everyone happy? Thank you very much, and thank you again, Alison. So that brings us to the next item, which is going to be introduced by Hayley Thomas, the reorganisation of localised vascular services. So over to you, Hayley.
Diolch, Cadeirydd. Mae'r papur hwn yn gofyn i'r bwrdd cymeradwyo defnyddio'r adborth ymgysylltu i liwio'r broses o weithredu y rhanbarth ar newidiadau arfaethiedig i wasanaethau vascular yn Ne-Ddwyrain Cymru. Thank you, Chair. This paper sets out the engagement findings and feedback gained from the recent engagement on key components of service changes to deliver a future configuration of vascular services. The engagement took place between the 19th of February and the 16th of April, and the board had considered in the January meeting the purpose of the engagement. There has been a long history to the development of these proposals, and the engagement documents are enclosed with the paper setting out the case for change. It is about the region finding a different way to meet the growing need and demand for services, and also address some quality standards and also the recruitment and retention challenges for the workforce it needs due to services being spread too thinly. So within the engagement, there was a proposal around a hub and spoke model preferred as the preferred way forward for the clinical delivery model. And that set Cardiff, University Hospital of Wales, Cardiff, and its position as a specialist and tertiary centre as the key hub, and the spokes being in Llandoch Hospital, the Royal Glamorgan Hospital, the Grange University Hospital and the Royal Gwent Hospital. But we did consider in our meeting in January that the importance of noting that the majority of pre and post-operative care, including rehabilitation, will continue to be provided locally across all communities and local hospitals across the region. So this paper now sets out the approach that was taken to the public engagement process. It provides an analysis of the feedback received, summarises the key themes that emerged, and also provides some commentary on that, including an equality impact assessment. The report covers the engagement that took place across all 4 health boards, so that is Aneurin Bevan, Cardiff and Vale, Cwm Taf and ourselves, and the board will be aware that there's a South East Wales Vascular Services Board that is in place to oversee this regional piece of work. 110 people responded formally to the engagement through an online survey. 7 virtual public meetings were held, 1 third sector meeting, and the proposals were also discussed and shared through our internal mechanisms as well. And of those who replied to the online survey, 72% agreed with the national evidence and recommendation that a hub and spoke model would improve vascular services and patient outcomes for the region. This was a difficult time to conduct engagement, and obviously the report covers the digital platform and the approaches and mechanisms that were used during this time as well. And we're really grateful for the members of the public, staff, stakeholders who have supported the engagement process during this time. Just wanted to highlight 2 areas, Chair, before we consider the questions people may have. The equality impact assessment that is attached, the detail of that, it's in the sort of summary cover paper, but we believe that the assessment has set out that the proposed service redesign does not introduce any additional obstacles. Improving standardisation for access and specialist treatment should improve outcomes across all social groups, but it was noted that there is a relatively small number of cases not currently treated at the centralised site in the University Hospital of Wales, and from the national evidence and research, the majority of cases are male and aged over 65. The Quality Impact Report also covers the issues around visiting patients and the complex journeys that people are likely to need to take, and particularly the journey times for public transport, which is particularly relevant in terms of equality groups and also car ownership. So one of the mitigating issues that the regional sort of team have been speaking about is ensuring the early transfer of the patient back to a local hospital would help to mitigate long periods in unfamiliar surroundings. Really grateful to the CHC who considered the content and detail of the engagement report and findings at their executive.
I think we have a problem with the sound, Hayley.
Oh, sorry. Have I lost you for long? Am I back?
No, just a minute probably at the most.
Oh gosh, okay. So I'll just go back then. So the Community Health Council,
yes,
I hope you heard that part, okay.
Yes,
so the Community Health Council have considered in their executive committee on the 11th of May the content of the report, and they have agreed unanimously to support the proposed changes to the vascular services in South East Wales. But in supporting those, that they made some observations. In particular, they're set out within the cover report and is in line with equality impact issues that I've just referenced, but particularly parking at University Hospital of Wales, how consideration of travel time and public transport times should be taken into account when arranging appointments for patients travelling from Powys. And also reiterating the consideration be given for pre-hospital rehabilitation and care closer to home, including the potential of using Powys facilities. So that's a quick summary of quite a long, large number of papers and appendices for the board. The board is asked today to consider the views of the CHC. And also to being asked to approve the engagement feedback to inform the implementation of the network. Thank you, Chair. I'm happy to take any questions.
Yes, thank you, Hayley. And I would echo your thanks to the CHC for the work they did on this. Questions then. Mark Taylor.
Thank you, Chair. I think the direction of travel is very clear from the documents as to which way the model will go, and no comments around that model, but it seems to make sense in terms of delivery. Obviously, from our perspective, the model focuses around, in terms of critical and planned care, around the M4. I think we raised it in January in terms of the opportunity for us to actually enhance and build upon our services that can be provided locally, and making sure that those are in sync with the proposals as they get implemented. Are there any specific opportunities we might have identified or can be looking to develop in support of that? Thank you.
Yeah, thank you, Mark. Yeah, I think that, generally there is a view that there could be potentially more opportunity of what we could be delivering potentially within Powys facilities. But at this stage, we haven't got concrete plans to do that, and that will be part of our sort of response going forward in terms of renewal and the key priorities that we need to do. But I think the reassurance is in the local meetings, and I don't know if you've had an opportunity to look at some of the notes of the meeting, but certainly both Cwmtaf and Aneurin Bevan were keen to speak with us about those opportunities going forward. But just to reassure that in terms of the key issue around the service change that we're discussing today around the hub and spoke, that the core sort of pathway bringing back to the local hospitals at the moment is the current arrangements as is, which is to the existing hospital sites as that's provided for. But we can certainly explore it, but we're not, as part of this stage, suggesting that we can put that in place from the start.
Thank you. Thank you, Mark. You're happy with that response?
I think in part, obviously I've got to be realistic about where we are at the moment and about everything that we can do. I think ideally, you know, we need to be on the front foot rather than responding to this in terms of when it gets implemented, as can be the case sometimes when things get escalated or accelerated. So I think it's just being aware of that and doing the best we can.
Yeah, thank you. Thank you. Trish was next with a question, and then Robert.
Okay, thank you, Hayley. My question is about the equality impact assessment and the fact that it will be ongoing. I think there is a missing sentence at the very last paragraph at the end about halfway down page 5, and I just wondered if you could clarify a bit more about what we hoped to achieve. It says the equality impact assessment will continue to be reviewed to further develop and refine this assessment and to ensure. And I just wondered what we were ensuring, and also whether or not, as we go forward, the equality impact assessment will also include a review of our socio-economic duty, which is now part of what we must do.
Yes.
Thank you. Good point. Yeah.
Yeah, thank you, Trish. I think there is a brief reference to the socio-economic duty within the report. I think there's a recognition that there's an ongoing piece of work to do there. I will double check. I'm trying to desperately find the reference that you're at to be able to answer your specific question around if there's anything missing in the report. Can you just check, is it the cover report or the main report you were referencing?
It's the cover report, I think, but I equally don't find it easy. So it's 2.2. It's the cover report, and it's on page 7 and page 5, and it relates. It's the very last sentence on the equality impact. Just immediately above the views of the Community Health Council.
Yeah, thank you. I've managed to find it now, Trish. I think from my perspective, apologies for that, but I think it's about ensuring that the equality impact assessment, that the issues that we've highlighted, we'll be tracking that through the process. But I will double check that position. I think from the work that you just referenced around the socio-economic duty, I think that we've picked this up in previous board meetings. That is one element we've looked at, but I think that is an area for further development as an ongoing process around the equality impact assessment, Trish. So we will pick that up as we continue through the process through the regional team.
Okay, thank you. I mean, I am hoping that we will track it, and so I look forward to hearing from you. Thank you very much.
Thank you, Trish, for that question. Robert, your question.
Yes, for me, this falls into a sort of a pattern which we've seen before, and no doubt which will be repeated again, which is the balance between the need to provide highly specialised and care for serious conditions on the one hand, and the issue about access and the impact on the other. Of course, for many people in South Powys, there might only be a few miles difference between the getting to the centre, that is to say the Heath, and going to the Grange. So in that sense, we are, different from perhaps other people in South East Wales who might be affected. But if I could just add support to Mark's comment, just to sort of to say that this. If this could be added to the list of possible items to be considered as we fight back, as it were, and consider what services over the next few years could be delivered in Powys. I think that would be quite reassuring as well to members of the public, that once again we are thinking about what can be delivered within the county. So just to add at the end that this is a very thorough consultation indeed, and a huge amount of effort has been put into it by this board, but also other boards and the CHC, and I don't think anyone can argue that people have not had the opportunity to look in great detail as to the consequences of these changes. Thank you.
Thank you, Robert.
Thank you, Chair. I've just found the missing sentence. Trish, apologies. It should have said in the report to ensure that equality considerations continue to be at the heart of implementation. So apologies for that administrative error, Trish. And Robert, I note your comments, and we will continue to look at that. Thank you.
Thank you. Yes, thank you for raising that, Robert. It's a perennial problem, you know, when people are seriously ill, as you say, to ensure that they have the very best possible treatment when access may be difficult. So thank you for raising it. Are there any more questions for Hayley? Not. Can I ask you then to note the content, as we indeed have, of the reorganisation of vascular services into a hub and spoke model vascular network for South East Wales, and the report on that. And then consider the views of the community health councils, as indeed we have, and then finally to approve the use of the engagement feedback to inform the implementation of the South East Wales vascular network. Everyone happy to approve? Thank you very much. Thank you. Thanks, everyone. Right, so that brings us on to the third section of the agenda, which has a number of items for discussion in it. And we'll start off with the really exciting development, the Workforce Futures strategic framework. I understand there are quite a lot of slides. I'd also like to welcome Carl Cooper, Chief Executive of Powys Association of Voluntary Organisations, who's going to be in attendance for this item and supporting Julie Rolls, who will lead it. So would you like to start, Julie?
Yes, thanks very much, Chair. And I note that we have a specific time slot for the delivery of this slide pack. So my intention is to ensure that we pass through the slide pack quickly and then pick up questions at the end, if that's OK, Chair. Just to say thanks very much to Carl. And as you will see in terms of the very first slide, that this truly is a piece of work that is being undertaken in partnership. And Carl is leading a core piece of that work, which I know he will talk about in the presentation. I will hand over to Carl for that piece of work. So although we've signed off the Workforce Futures strategic framework as a board, it's also gone through each of our sovereign organisations in terms of PARVO and the local authority, Powys County Council. I'm just going to bring us to the first slide proper now, and just to reiterate and actually refresh people's memories about the Workforce Future Strategic Framework and the really positive discussion we had as a board when this was endorsed by the board, recognising that the framework itself is core to the delivery of the health and care strategy and absolutely essential in terms of achieving our ambition. And I recognise that some IMs have already flagged that in terms of our aspirations around our services. The framework itself has 5 themes, which are on the slide: education and training, designing, planning and attracting our workforce, partnership and citizenship, leading the workforce, and engagement and well-being. And just to say, we anticipate every aspect of our Workforce Future strategic framework to be underpinned by Digital First, which, as we know, is another core enabling framework. I want to just move on to the first of those themes, which is the education and development theme, and perhaps something that people will be able to see will be the arrival, shall I say, of the first part of our aspiration around the Health and Care Academy. And I have to say that we are really, really excited about the developments, particularly here at the Bronckley site, but also recognising this will be a model that will be moved out across the organisation as we pick up the North Powys work as well. So just to say that the The Academy itself, the Health and Care Academy, has been agreed in partnership, and there are a number of different schools that will make up part of the Academy, and they again are identified within the slide pack. So there will be 4 schools, one of leadership, one of professional and clinical education, volunteers and carers, and I know Carl's going to talk to us about that, which we are very, very excited about, and then research, development and innovation. So they will be the schools within the Academy, and that model will be replicated. However, if I move to the next slide and we look at the building and our aspiration for the building, and it is really, really important in terms of this being a state-of-the-art physical space, which we haven't had anywhere else in Powys. It's due to be opened in probably early autumn of this year, and it will be our Broncleys campus. At this moment in time, we are looking at what was Basil Webb, but there will be further work that we will need to do on the site at Broncleys to look at both outside learning opportunities and then adaptive learning opportunities within one of our bungalows. So this will be an opportunity for us to create a home environment where practitioners can learn together in terms of providing care and development to the population of Powys. And that is planned for one of our bungalows, as I said, and that will start to be developed in the coming months. So what I want the board to be aware of is that you're seeing the first piece of the jigsaw puzzle, which will be escalated across both Powys as a whole, but certainly across the site at Broncleys. So if I just go on to the next slide, where we just talk about what the proposed Health and Care Academy model was about. And core to this has been our ambition to be that exemplar in rural health and care and professional education, being the sector of choice where people come to Powys, they develop in Powys, they learn in Powys, and they stay with us in Powys. To have a leadership talent that operates at all levels across all sectors, where we have leaders learning together and being together, responding to people in a timely way, and recognising that we have the ambition to be the centre of excellence for research, development and innovation. And again, we have had previous presentations which have talked about our approach to innovation and research. If I go on to the next slide and I talk about the early deliverables, well, the programme is being scoped. There's lots of things that have happened since the delivery of the initial framework and its approval. As we said, the first being the Education and Development Hub, the Academy Hub at Broncleys. We are working with the Academy to look at how we can develop a digital learning management system. And I know that's not about replacing ESR, but if you look at most modern university providers now, they have a forum in which people can learn, access and have virtual reality presentations. We've got work with Aberystwyth University, and we know that the university is currently working with ourselves and Halvar in developing a rural nursing degree, and we are key participant in that work. We are working with Health Education Improvement Wales in development of the Primary Care Academy, and we're working across the whole of the sector to look at how we can best make use of our multidisciplinary learning and cross-sector training, because what we want to do is see all our sectors learning together. If I move into the next part of the theme, it will be around the designing, planning and attracting workforce. And just to say that we have had an ambition to ensure that we have a career pathway that supports children who want to access a career in health and moves right the way through the life cycle of employment. So we've had some very early wins in this area. One of the first being the Arwen Employability Training Scheme, whereby we are able to support people who want to have a career within the health service, helping them with both development of basic CV writing skills, etc. But those people who want to move forward into clinical education, and we've had some funding in relation to that. We started a Kickstart Program, and we're about to have our first cohort starting in June, where we are designing a full training programme for people who want to enter a career in health and social care with the third sector who are currently on universal credit. And we are scoping the education provision for South Powys to start with, looking at school-age children between who are at years 10 to 12. And we certainly have started to develop our apprenticeship offer and our apprenticeship offer in care. We're seeing that we started with 2, we're now up to roughly 10, and we have ambition to grow that. We're also looking to explore our escalated model of the Open University, whereby people can be working as healthcare support workers and studying for their nursing degree at the same time. And I'm certain that people will understand the absolute vital piece that the Academy will play in doing that. We will not be able to deliver any of these schemes without that Academy site. The next theme is working in partnership. I am going to hand over to Carl just to talk a little bit about this, and certainly the volunteering aspect and the work that's been happening under the community sector response group. So Carl, if you don't mind, if I just hand you over in terms of those 2 particular slides.
Yeah, thank you, Julie, and thank you, Chair and board members, for the opportunity to be with you and to, I think, just being here, offer that affirmation and assurance of our close partnership in this area and indeed wider. So very quickly, the next 2 slides. We've set up what is known now as the Community Sector Response Group, CSRG. The CSRG has built on and galvanised the work that we did together as an emergency response in response to COVID, well, over a year ago now. It's important perhaps to note that the CSRG also meets statutory requirements. The Social Services and Wellbeing Act places a requirement on the Regional Partnership Board to establish what it calls a social value forum. And in Powys, we have a social value forum, but we call it the Community Sector Response Group. And the purpose of that is to support the development of social value initiatives in order to improve people's well-being and in order to support their health and care requirements. And so, so the CSRG has been up and running now for about 9 months or so. And really, the last year, within the Workforce Futures framework, the strategic framework, there was more than an aspiration. There was a commitment to developing a health and care volunteer force as part of the workforce within Powys. But actually, that's been kick-started in a way that none of us could have imagined. And you'll see the information on the slide there about some of the things that we've been able to achieve together over the past year and a bit. So certainly over the past year, we've recruited and placed nearly 1,400 additional volunteers. We've actually placed over 200 volunteers within Powys Teaching Health Board settings, and of course that's not to mention the over 400 volunteers that we've recruited and that we're placing within the mass vaccination programme. So there's a lot more that could be said, but it just gives you a flavour of some of the things that are doing. And very, very importantly, the 13 local community support networks that are led by our community connectors that are supporting that spontaneous community resilience explosion, really, that continues to take place within every community across Powys and beyond. And then the next slide turns our attention to the School of Volunteers and the School of Unpaid Carers within the Health and Care Academy. And again, this is really exciting. I do think that Powys is a trailblazer here, that we embedded within the Workforce Futures strategic framework a real valued place for the unpaid workforce. And that here is seen represented within the plans for the Health and Care Academy. And we're about to launch, although it has to go through some final consultation exercises through CROG and RPB and so on, a 5-year strategy for volunteering in Powys and for unpaid carers, and that will be supported by a 3-year operational plan and a 3-year resource plan, which will certainly come to you as a board, because the hope is that that will then support your own planning and your own strategies as a sovereign body and as an organisation. And so we're really excited about this school of volunteers and unpaid carers, and we've commissioned some external consultants that are now reporting to us about how we can begin to flesh out the detail of what that school will actually do and deliver in order to build the skills and equip properly our volunteers and unpaid carers in Powys. And my last observation, if I may, is really around risk. I suppose if I were to identify the main risk in all of this, is that we're not really sure about what's going to happen to ICF funding beyond this year, and community connectors and other bits of this environment are currently exclusively dependent on ICF funding, and what happens after the 31st of March is still an unknown. And so there is a risk there of which to be aware and that we need to manage together. Thank you.
Thank you, Carl, so much for that. If I move us on then to theme 4, which is leading the workforce. Again, we all know that leadership is key at every level, including clinical leadership, but some of the work that we've already endorsed in terms of developing our assistant developments, but certainly developing our talent pipeline by graduate placements, etc. We now have some MBA placements linked to the innovation and improvement team, and we're working on how we can develop that skill throughout. This is obviously really closely linked to the next theme, which is engagement and experience, because we know that an individual's experience of being in work is very much linked to the leadership that they receive within that role. In terms of leading the workforce, we are really again excited to be part of a digital transformation bid, intensive learning academy bid, which is led by the University of South Wales, for which we are a partner. And you'll see on the slide that there are a number of partners across the piece, but we are expecting to be piloting some work if that business case is fully approved by Welsh Government, and we're expecting that decision to be made later this month, where we are supporting digital transformation skills of our leaders from a level 3 right the way through to masters. And I know a discussion of board is how do we develop those digital skills, that business intelligence knowledge, etc. And that will be a core part of that bid with the University of South Wales. But also they will be supporting the development of some of the simulation labs that we will need as we develop that skills programme, and how we link to the university already are well versed in this type of technology, but how we get that into Powys is really, really important, so that the aspiration is our workforce can develop their clinical, professional and career progression whilst they're in Powys, rather than having to leave Powys to develop that. In terms of the theme 5, the wellbeing and engagement work stream, we know that a key part of the discussion that we'll be having will be around our agile workforce, what that means in terms of our working cultures, and we're trying to replicate that through the work of the Workforce Futures and certainly through the academy work. But we are also looking at how we can develop the initiatives that we have across all our partner organisation. So in relation to engagement and staff wellbeing, we have one standard across the piece where people feel that they can access support, etc. And we've got examples of that. There've been a number of recognition events that have happened, which have been been sector specific, but I guess the aspiration will be how we get an overall approach. I know Hayley was at an event, I think it was Friday evening, Hayley, in terms of volunteers, but we are working together so that we can look at how we get health and care recognition events across the piece. And then if I just move on to the next slide, I wanted to talk a little bit about the investment that we've had to date. And Carl's already mentioned that. I think we've had to start somewhere. We've had to start by capitalising on the investment we've had. We have been supported in this programme under the RPB via ICF Capital. We have had funding for some of the initiatives such as Kickstart, so not only is it the right thing to do, but some of these schemes attract resources which help us enable and deliver our ambition. We've had funding from Arwen in terms of supporting that initiative. Carl has mentioned the National Volunteer Grant, and we will look to how we can support that. And we've been utilising the Carers Grant that we have each year. So there is funding that we've been utilising and capitalising on to realise and bring this ambition forward. If I just move on to the last slide. So the programme, hopefully you can sense the amount of work that's gone into this programme. Some of the aspirations that we germinated are starting to grow. They're not quite at the scale that we want them to be at. But we're certainly looking, we certainly now have the building block. And as I said, the Academy is a real anchor point for people to see and feel that difference as well. And we have a range of programmes beyond in terms of how we move forward in terms of supporting this initiative. And I think that we need to look at this model and our aspiration, how we tap into those sources of funding that will make this something truly unique to our staff, which is above and beyond anything I think we could have anticipated. So I don't really want to say anything else, Viv. I know there is a lot of information contained in this presentation, and I'm happy to take any questions. I'm sure Carl will be as well. Just to say, Ali Bulman would have been here, but Ali's on holiday as well, so that's the reason why Ali isn't here. So I'll just pause there, Chair.
Yes, thank you, Julie. And Carl, very interesting to see what developments have come to us working collaboratively with PAVO, and you know, the significant success they've already had on their work with volunteers, plus the trailblazing that he mentioned in developing the school of volunteers and unpaid carers. So thank you for attending, Carl. Carol, would you like to come in just before we take any questions?
Yes, thanks very much, Chair, and thanks to Julie and Carl for an excellent presentation. And I just wanted to comment really that this was one of the 12 and then became 13 strategic priorities of the board last year. So I wanted to reflect that at the time I think there may have been a question mark in some people's minds as to why this was being prioritised whilst we were dealing with a pandemic. And I hope that through the presentation we can see that actually the Workforce Futures strategic framework, and particularly the Health and Care Academy development, will help us to recover from the pandemic in terms of giving local people opportunity for training and development and career progression. But also enabling our own currently employed staff and colleagues in contractor services in primary care to adapt and flex their own skills and their own developments for what we have ahead of us in terms of renewal programmes and different models of care. So it was a comment really that I'm personally delighted to see the progress that is being made, and it's all the better for this being in partnership. And I do agree with Carl's comments that we are creating something here that is really quite unique, and we do have an opportunity in a couple of weeks as the exec team. We have an accountability meeting with Welsh Government, and I'm hoping that we can share some of the details of this development with them as well. So thanks, Chair, and thanks to Julie and Carl.
Yes, thank you. Are there any comments from the independent members or questions? I think we're bowled over, actually. Susan, Susan, you've got a question. Well, a comment anyway. I think maybe just a comment. Yes, Trish Buchan.
Hi, I'd just like to echo Robert's comment about the amazing presentation. I'm thrilled to see this progress forward. It's something that we've talked about over a number of years when we had a workforce committee. So it is something that has been long in germinating and it is beginning to flourish. I do note that I feel very strongly that it helps us to comply with our responsibilities under the Future Generations Act in terms of our 5 ways of working, and actually also particularly with even the recent work done with people on universal credit, that we are starting to look seriously at implementing our responsibilities under the socioeconomic duty. You might have gathered I'm interested in that. Yeah. But I think it is important that we have a really good business case and a firm understanding of how things are going to be funded, because we're going into a period when we're not likely to have a lot of money around, and so I think it is important that we look to make sure that all elements of the academy and the building are able to be funded in a sustainable way.
Yes, thank you, Trish. Did you want to come back on that, Julie, or shall we proceed with questions?
I was going to say, obviously, the academy funding is set out in terms of this phase of development. In terms of funding, it will we have to look at lots of different sources because we have lots of different partners in relation to this. I take your point, Trish, but I also wouldn't want to lose an opportunity where we are constantly looking for sources. The funding does not necessarily have to be about an internal funding stream, because there are a range of opportunities that will enable us to support and achieve these ambitions. I also think it's important to note that universities are all looking at in-reach models. That is the aspiration for the future for universities. So there'll be different types of partnerships that we'll need to develop. And certainly for us, if we had not invested in the way we had and we had not secured the funds we had, it's very hard to in-reach into nothing, so to speak. But we now have that first building block of that in-reach model, which universities are now going for, and it will represent the approach to an agile culture that we're trying to develop.
Oh, thank you, Julie. That's so encouraging. I think Robert wanted to come in, and then Susan.
Yeah, as you know, I have a mathematical background, so I'm going to give this presentation 11 out of 10. Okay. I think it's quite dazzling, and it's dazzling in its ambition and also its importance. So members of the public and people living in Powys should be reassured by this, because one of the ways in which medicine and health in general is going to develop is through doing things differently, and that innovation requires the staff, and we can't do things unless we've got a stream of staff coming through. So in numerous ways, both full-time staff and also with the community and volunteers, this fits the bill. So it's extremely important that it's seen not as an add-on, but as something really essential for us to make progress in an area that we have always struggled, which is to attract sufficient numbers of staff to realise our ambitions. So there's a lot of work here has been done, a lot of work to be done. It will involve every department, but it's an excellent beginning, and thank you very much for so many people who have done a lot of work on this over the years. Thank you.
Thank you for that, Robert. Susan.
Yes, thank you, Chair. My comment was that this is a wonderful opportunity for all grades of staff, and I'm very pleased to see how it's developing. But also I want to take this opportunity to acknowledge the tremendous amount of work and well, I can only say partnership work for the volunteers at the mass vaccination centre. They really have been wonderful, and the general public, whenever I've spoken to anybody outside, they've always said how smoothly it ran, and that's very much down to the volunteers as well. So thank you, Carl.
Yes, thank you, Susan, for taking that opportunity. It's really important that we do acknowledge it. Well, I think we do have to move on. Now, I'd love to linger on this and talk about it all day. Perhaps one day we'll have a conference to celebrate. But in the meantime, diolch yn fawr both, and especially Carl coming along in the middle of his morning. So thank you.
Thank you,
Carl.
Good to be with you.
Yeah. Right, so we'll move on then, shall we, to the next item on the agenda, which is important. Item 3.2, performance reporting. I think Hayley's going to kick off on this.
Thank you, Chair. Apologies, had a bit of problems with Teams this morning. Diolch am y cyfle i gyflwyno'r adroddiad perfformiad diweddaraf i'r bwrdd. Thank you. This report provides a high-level summary of the latest performance position against the National Delivery Framework, but also at the start it covers a little bit of the latest position around COVID. Just to update the board with regard to the COVID incidence rate, as of yesterday, the 25th of May, the cumulative position is that 4,291 residents have had a positive test outcome in Powys, and the last 7-day case incidence rate as of today is 2.72 cases per 100,000 population. There have been only 3 new cases in the last 7 days. So the test positivity rate has also reduced from 1% as referenced in the board paper for when it was written to 0.37% for the week ending the 21st of May. And that was based on 2,157 testing episodes. So we continue to work very closely with our local authority partners to deliver the contact tracing elements of this work, and the performance remains excellent. In addition to the emphasis of the tracing element of the surface, we are also increasingly now having to pick up work around returning travellers, given the requirement to follow up people returning from amber rated countries. And also in terms of the testing, now there are a broader range of testing being implemented, the latest of which will be asymptomatic testing due to start in June. In relation to the deployment of the vaccination programme, we are making excellent progress. The latest figures for this is that we have delivered a total of 156,445 first and second doses within Powys, and of those 102,000 are first doses, and over 48% now of the Powys people have now had the opportunity to receive both doses. So we're well ahead of the government's target at the end of July, and we are focused on the leaving no one behind and the follow-up of continued administration of second doses at this stage. We are just starting planning in relation to the requirements for the phase 3 of the programme, and we should be able to have final confirmation of the approach expected soon with regard to the booster vaccination programme. So that will be the next aspect for that. The report covers on a summary level a number of key areas, and I'll be asking executive colleagues now to highlight a few of those areas within the report. If I could just ask Stuart first whether you'd like to add any few points on the COVID sort of update, or the broader progress that we're making with the public health prevention measures or the screening programme, Stuart?
Yeah, thank you, Hayley. I'll just briefly go back to the COVID figures first, and then I'll give a bit of a broader update on prevention and response more generally. I think Hayley summarised the picture very well. We are at one of the lowest case incidence rates that we've had for some time, with if you look at local authority area, we're the lowest local authority at the moment for case incidence. I would just note that that can change rapidly, and certainly modelling suggests that we're certainly not out of the woods yet. And I think as we roll forwards into spring, summer, I would just urge a little bit of caution on case incidents, particularly as Hayley has alluded to in terms of returning travellers and the potential impact of returning travellers as we move forward over the spring, summer. So we're absolutely in a very good position at the moment in terms of positivity and in terms of numbers of cases. But I would just earn a stroke of caution around summer and what that might lead to. Just to note, in terms of summer, looking ahead a little bit and talking about prevention and response, we are currently looking at some mass events over the summer and working through how we can support those events to operate in a safe way over the summer period. And we're doing that in conjunction with local authority and wider partners through a safety advisory process that we've established. And there is an event that's due to take place in early June in Brecon. That's one of the trial events nationally that we've been involved with, looking at the safety of that event, but there will be others over the summer that we'll be looking at as well. Otherwise, more generally from prevention and response, we are currently refreshing and updating the prevention and response plan for Powys, with the deadline of submitting that to Welsh Government by start of June, and we will take the feedback from that plan from Welsh Government, and we will further revise that plan as necessary, with the main focus being on capacity to cope with potential surge testing and the arriving travellers position over the summer. And that's it really, Hayley, thank you.
Thanks, Stuart. So I'd like to move on, if that's okay. I'll be asking Jamie to come in at the moment, but in terms of the summary level around the continuing focus around our backlog of people waiting treatment, I'll just give you some high-level figures and then I'll ask Jamie to come in with some detail. We've now over 3,000 people waiting more than 52 weeks of treatment as a commissioner across Welsh and English providers, and as of April, a total of 443 patients waiting longer than 52 weeks in Powys as a provider. The key specialties of concern again remain the same for both English and Welsh providers. They are trauma and orthopaedics, ophthalmology and general surgery. But I will ask Jamie to come in to provide some further assurance and detail around the progress that we're making to deal with this issue. Thank you.
Yeah, thanks, Hayley. If you don't mind, I'm going to cover a few topics in one go. Hayley has discussed. I'll cover off unscheduled care, what we call planned care, but also other areas as well, if you don't mind, including mental health. So if I cover off unscheduled care first, colleagues, our minor injury unit delivery is 100%, as we have come to expect in Powys, but I wouldn't want to just not flag that up to colleagues that we continue to do what we need to do within Powys for our local residents. Our key challenge in the unscheduled care arena, it actually is the red performance, as it's called, for Welsh Ambulance Service at 65%. This has not delivered much in the last year, and probably only 1 month in the last 14 months. We are working with Welsh Ambulance Service on options around this, and only this week I've met with them again to be clear of the actions they are taking, the options for further improvement and what we can assist with. They're also scoping up a proposal of what we would call a rural model, which will reflect our specific needs in Powys. This will be discussed with them and also with the Ambulance Commissioner, but I just wanted to show that this is a target that we are very keen that is delivered for our Powys residents, and we work with Welsh Ambulance Service and other partners to do that as quickly as possible. I would want to note, in fairness, that our amber performances is called, those non-red calls, and the weights in our community in Powys is invariably the lowest in Wales, but I think our focus has to remain on the red performance and get that up to the level it needs to be. With regards to the waiting times that Hayley's alluded to already, we would wish waiting times were presented were much shorter, and the teams within Powys are doing all that we can to minimise those waits, bearing in mind the unprecedented prevailing conditions within which we've been working. Members will recall in previous updates we've outlined the services that have commenced, and this paper reaffirms that detail also. Clinical teams continue to monitor all referrals and clinically prioritise referrals on the waiting list. Now, our waiting times still present a challenge, and we're not where we wish them to be, but we are continuing to show progress in our waiting times, with the number of people waiting longer than the target date actually is now dropping into April as well. We're now into late May, so you would expect me to have more accurate data, and Hayley's alluded to one or two of those already. So April has seen an overall drop in our numbers within Powys. It's down to 618 people over 36 weeks, down from 690 in the previous month. And the 52-week figure I have is 453, down from 536. That is a lot of work to be done still. That is progress, but we would expect to see that progress increasing in coming weeks and months now, with additional support from Welsh Government, which has been in the national press around what we call recovery and renewal monies that will help us move at a pace with that. And we'll update colleagues and members on that in the coming weeks. Therapies is performing well, and the sole remaining area with patients longer than 14 weeks actually is podiatry. We're having an update on podiatry later. I think you'll see the scale of the work that's gone into podiatry, but I would expect that podiatry in the next couple of months is back to a position pre-COVID of no wait over 14 weeks, and I think there's a lot of work that's gone on with services to achieve that within therapies in the past months. Non-obstetric ultrasound remains a position and a challenge for us. This is improving, and I've been able to approve additional short-term workforce to be secured to help that come down as quickly as possible. I would aspire to have that down by July, if not before, and the team are working to provide that target of 8 weeks by that period of time. Mental health, we actually have achieved all of the targets in part 1 and part 2. And I think it's worth flagging up other good initiatives that we have got. I think it was mentioned in the TDP, learning difficulty care homes have been vaccinated as well by the mental health team, so they're doing their part beyond the targets. And good work on Silver Cloud. I think we are noting that our referrals for services are going up. So I think it's probably not a surprise at all. With what's going on in the STM report was we have been talking nationally around the concern around the growing demand for lower level mental health services. We would call it support, advice, etc. And we are seeing that within Powys. It's early days, it could be a little blip, but we have seen referrals going up. The benefit of Silver Cloud is we are signposting people to the right kind of support, which is not always a mental health professional, and that's a benefit we have within Powys. Neurodevelopmental is mentioned. I'm flagging it up on purpose, colleagues. That has slightly improved in the coming months. We have again proposals in place we're working through now to see a more dramatic rate of return to that position for neurodevelopmental in the coming weeks. Endoscopy remains well placed. So I think overall, Hayley, I think that's some of my colleagues of where we are across the key performance measures for Powys as a health board provider of services. I would want to assure colleagues of our continued focus that we need to get our waiting times back to where they were pre-COVID, which was a very positive place, but there is still a challenge ahead for us, as you all imagine, being in the COVID pandemic.
Thank you, Jamie. Really appreciate that. And then just a couple of other areas to highlight. Alison, wondered if you wanted to pick up the Health Board's compliance to complaints, etc.
Diolch, Hayley. Yes, thanks very much. Welcome the opportunity to do so. To bring attention to the improving trajectory, as mentioned a little bit earlier, in terms of our compliance with the 30-day response rate for complaints. We've obviously got some way still to go, and we are still below the All Wales trajectory, although we are moving in the right direction. Some of the challenges for us are the change in national picture in relation to managing this portfolio, as alluded to in the PTR paper, and also the elements of COVID that can impact on this agenda. Some of our enablers are our internal oversight arrangements in relation to this improvement work, our assurance and reporting mechanisms. We've had some targeted intervention with the team, specifically focusing, which has enabled us to undertake this improvement trajectory, and some of the underpinning elements, which are, as we've just had, the newly revised PTR policy and the introduction of the Once for Wales concerns management system that should help us with data intelligence and planning.
Thank you, Alison. And last but not least, Julie wondered whether you'd like to give some comments around the workforce measures.
Yes, thanks, Hayley. I know that we've discussed this at Performance and Resources Committee, and certainly something we've discussed at the executive team as well. We have seen a dip in our performance appraisals over the period of COVID, but we now have plans in place to increased that area. We know it's absolutely vital as part of our improving performance framework, and we have been asked to ensure that, or we've asked all directors to ensure that this is given a focus and priority in the forthcoming months to ensure that we've been able to get our performance back to where we expect it to be. I know Carol's currently reviewing all executives' appraisals, and I'm sure that that will be a core part of the expectation as we move forward. So recognise that this is something that has impacted across Wales, but we also recognise and are committed to that improvement performance trajectory.
Thank you, Julie. So, Chair, we're happy to take any questions people may want to ask.
Jamie, did you want to just come in again, please?
Sorry, if you don't mind, Chair, I did want to only just to support Julie. Julie's the workforce director, but it's not really fair that it's Julie's target. This is what the team's doing. So I'm very proud to have the bulk of the workforce working in my portfolio. So I want to assure colleagues that as per my updated performance resource committee, I am seeing those numbers improving already, Julie, as you will know as well. So I'm seeing some good growth in all of my service groups. I think our biggest challenge is medicine management. It's a smaller number of people, but I think colleagues will recognise why our pharmacy team are currently focused a lot of their time and effort on mass vaccinations.
Right.
But I think however, I am seeing that growth that I expected following my commitment to the P&R committee. I just wanted to assure colleagues that that action is in place and we're seeing it.
Thank you, Jamie. Thank you very much for all that information. We have 3 questions so far, one from Robert, then Mark, and then Ian. So Robert first.
Right, thank you. For a question for Jamie, really, about WAST. Before COVID, there were some questions raised as to when the Grange was opened, as to whether or not there would be the issue of abstraction of vehicles. In other words, vehicles arriving at the Grange from Powys would then be utilised for, for emergencies in say Newport or whatever. Going forward over the next year or two, will we be able to pick up with WAST as to whether this is kind of thing is happening? Whether this effect will have an impact on people in Powys or not.
Yeah, thanks for that, Robert. I'm not sure I can turn my camera back on. I'm sorry, because we've maxed out, so people have seen my face already. So I think it is early days. I think clearly with the work we've done closely with the Welsh Ambulance Service and other colleagues, I know Carol may well comment as well, but we are monitoring those trends and those flows, Robert, without question. I think at the moment the conveyances to both Prince Charles and Wye Valley and Neville Hall are in line with what our modelling was. Clearly, the number of patients going into the Grange are dramatically lower than they would have been into Neville Hall previously, and they've gone to Prince Charles. So we are monitoring that closely. There is no suggestion for me that our red performance is affected by that shift from the Grange to Prince Charles in any way, shape or form. And as I said, I monitor closely our overall community rates for activity. I'm not in any way condoning the fact that we can't hit that target within Powys. It's a grave concern for myself. I know Carol, as well as Chief Executive, would share that concern. But I think there is a recognition of the low level of red calls that we have in Powys, Robert. It's between 18 and 25 a week. And bear in mind, rurality, it's hitting that 8 minutes. It's quite a challenge at the moment that they're finding. I need assurance of the actions that they can take and how we can help do that. But I would not think it's a link. But to the Grange, we are monitoring closely the South Powys programmes, we call it, and we'll get better intel as the weeks and months go on as to what the impact has been and if there is any impact at all in terms of red performance.
Thank you, Jamie. Carol, would you like to come in on that point?
Yeah, thanks very much. Jamie's probably answered most of it. I just wanted to stress the change in the patient flows for anyone who might be watching this meeting. So just a reminder really that urgent and emergency care flows changed in November from Neville Hall, and which would have been then the Grange, across to Prince Charles Hospital. There are small numbers of patients, largely from the Crickhowell area, who they're equidistant, so may well be accessing or are accessing the Grange. And just to say, Robert, to stress what Jamie has indicated, that a weekly review, and WAST have been excellent in participating very actively in the planning and the programme board itself in terms of monitoring, both planning and now monitoring this change. So we're not seeing any signs of concern that our ambulances are being diverted, particularly following that change, Robert. So I think that was the assurance that you were looking for.
Thank you. Thank you for that. Is that, are you happy with that response, Robert?
Yes, thank you, Chair.
Yeah, thank you. Could we then go to Mark Taylor, please?
Thank you, Chair. It was firstly an observation just to commend the format changes in the report. It's sort of moved towards the statistical process control, or SPC. I still get my head around it in terms of the text, but when you look at the graphs, I think we've taken the report in terms of where we are, but what we also see from those graphs is the sort of positive uptick that is starting to be clearly shown, certainly within some of our own provision. So again, just reaffirm that presentation improvement from my perspective. In terms of a specific, one area which I'd quite like some update on, or some assurance in terms of timescale, is around on page 327, which is the cancer Welsh provider performance and the non-availability of that data because of various database changes, etc. And I was wondering if anyone could, I know it's been escalated, but have we been provided with any timescale or confirmation as to when that will be available?
Thank you, Mark. Just on the first point, thank you for the positive feedback. I know Simon McClellan particularly has been really key in making the improvements to the report, so many thanks for that positive feedback. With regard to the cancer Welsh provider performance, it's still an ongoing issue that we're trying to resolve, and in fact we had our integrated quality planning and delivery meeting with Welsh Government yesterday, including delivery unit colleagues, to discuss, and we did discuss the need to resolve this. I'm afraid I don't have a timescale at this point, but I'm happy to bring an update to the next Performance and Planning Committee to provide a more detailed update on that, but we are trying to address it. We are looking at workarounds as well in terms of being able to access active data through the delivery unit in the meantime, but I will bring a more updated report. But this has been an issue we've been trying to resolve for quite some time now.
Thank you very much for that.
Ian Phillips.
Thank you, Chair. One comment and a question on follow-ups and a question on mortality. So the first one is to echo what Mark has just said in terms of the change in the presentation and in particular the statistical process control charts, which is it's great to see us plotting the dots. It is good. I think it does take you a while to get your head around this stuff, but I think you've made it easier for us to see this and for us to clearly see the trends and the trajectory. I think I particularly like the icons. I think they're very helpful. The orange, grey and blue icons as well provide that extra explanation to the graph. So thank you very much for that. In terms of follow-up reviews, there's sort of two parts to this for me, which is one, are we undertaking a review of the appropriateness of the follow-ups? And I think I know the answer from that from previous discussions in other subcommittees, but I think it would be helpful to hear that. And I guess looking forward to the future and the way that we would wish to see healthcare develop into more prevention rather than fixing me when I'm broke type model. Is there any work going on at an all Wales level to develop new measures to monitor new ways of measuring those people that are on continuous review or treat on symptoms or those sorts of things? Because it just strikes me that if we need to move to that model, as all the experts are telling us, then targets drive behaviours, And in the absence of measuring those new ways of working, then it's going to be a more difficult challenge for us. So I'll pause. Shall I pause on the follow-ups first of all before I go on to the second question?
Thank you, Ian. I think Jamie would like to come in on this one.
Yeah, thanks, Ian, for that. I've tipped my camera, hoping colleagues can see me. Without question, I know you will recall over many years the age-old conversation about follow-ups and the desire to patients to get followed up, for clinicians to follow patients recurringly again and again. I think this has been if I look for a silver lining from COVID, a potential benefit to look at that. I'm not going to preempt the paper on podiatry later on, but if you look at the paper there, you will see the good work done there on follow-ups. And I think it is an absolute tool that we're working through already, Ian, and making best use of. I can think of things we're doing at the moment on physiotherapy and MSK, our orthopedic lists, to see how we can help support that in alternative measures than just follow-ups. The phrase we use, and an acronym, is SOS, C on symptoms, and PIFU, patient-initiated follow-ups. That is a tool that we are rolling out in Powys. It is a national conversation. We're doing relatively well on that. I don't have data to hand right now, but I'm happy to pick up something on that in a committee in a future date with a bit more forewarning, if you don't mind, on try to get the information in. But I think some of that is about people understanding that they will not get lost if they are going to a patient-initiated follow-up. That's about working with the patient, a co-production of what the condition is and how and when they can alert themselves to the C on symptoms, and the patient-initiated follow-up gives the patient the power to come back into a system when they need to, not literally be on a recurring every 6 months and 12 months cycle, which has probably been traditionally over the past 30 years the NHS way of working. So there's good work going on, I promise you, and that's across all specialties, including therapies.
Thank you for that, Jamie. That's really helpful. I think perhaps it's something that we may want to come back to in terms of being able to report the progress in that area in the future. The second question and final question for me was on the mortality graph, which I guess I understand the complications due to the models of care that we've got in Powys, particularly around palliative care and the low numbers that can often skew these sorts of figures. I just wanted to ask, really, are we confident that we've got the reviews of those cases in place and that they're being done in a timely way?
Thank you. Kate's going to come in to respond to this. Thanks.
Hi, thanks, Ian. So yeah, we are carrying out twice yearly mortality reviews when we will review all the deaths from patients within our community hospitals. So that is in line with All Wales practice and will be in line with the medical examiner when they come into practice early in the spring next year. They will be independently looking at and reviewing all cases of patients who've died within the hospital. So we are mirroring that process now. It is rigorous. Each patient's notes are looked at by a senior clinician. We look for areas of good practice, areas of learning. We feed back to individuals and teams where we feel there is learning, and then a few cases from each cohort we will have a more in-depth discussion about, again, for learning and feedback. It's a really useful process in terms of, we often find areas of really good practice that we can cascade, but if we think there are things that we could have documented better, or if there is any important learning, we're able to cascade that around the organisation. So in short, yes, there is a rigorous process. I think it works very well, and that will continue.
Thank you very much, Kate. I think it's important that the public are aware of that, and thank you also to Jamie and Hayley. Thanks.
Thank you for that, Ian. I think Mel has a question, and then we'll have to move on to the financial performance.
It isn't a question. It was really just adding to the last point about the mortality, just to say that we've had it and discussed it and looked at how we deal with that particular question through the Experience, Quality and Safety Committee over different periods, and just the improvement, I would say, in how we tackle that and the thoroughness of it. I'm just adding to the conversation, really, that we have been cited on it. Thank you.
And I might just add that we triangulate the information with concerns in our learning group. We triangulate that information with other information from within the health board, just to make sure that we are properly understanding our processes.
Thank you, Kate. Yes, thanks for raising that, Mel. Could we then move on now, please, to financial performance and bring Pete in?
Thank you, Chair. So we have two finance reports today for the board, one being to cover the month 12 year-end position for 2021 and the second one being for the period of month 1 for the year 21-22. So just picking up on the key points for the first report, just to state to the board that our year-end financial position against revenue was an underspend of 129,000 and our year-end financial position against capital was an underspend of 27,000. Excuse me. Subject to audit, which is taking place, this means that we've met our statutory duty to break even against revenue and capital, which is a fantastic achievement. Also included in that report is the timetable for the year end. This covers the process for submission of our annual accounts. Audit Wales are progressing well with their audit, and the final complete audited accounts will be presented to board in early June. Excuse me. So just to pause there and take any questions on the month 12 position, and forgive me for coughing.
I think we can.
Yeah.
Any questions, please?
Okay, so if I move on to the month 1 report, as you've already heard, our annual plan is currently still draft, subject to being finalised for the end of June. This report is basically monitoring our performance against that draft plan. So as at month 1, we're £15,000 overspent, but based on our assumptions included within our plan, we're forecasting a break-even position. Just to highlight as well to the board that our capital resource limit for the financial year is currently 14.5 million. That's a significant increase on last year's capital spend, and just to note that for the board. I think really then just to flag, if I can take you to page 4 of the report. This is really a reminder of our current assumptions around our savings delivery for the financial year 21-22. So as a reminder, we brought forward an achieved savings target from last year. As you know, during the pandemic, there are a number of reasons why we were unable to make those savings as targeted. And in our financial plan for this year, we're assuming that delivery will start from Q3 and Q4, and the assumption is that we will deliver £1.7 million worth of efficiency and savings. This will be a regular item in reports going forward to track our delivery against that performance target. If I can then take you to page 5 onwards, included is the usual expenditure trend analysis comparing our current spend compared to previous years. This is in early stages given that we're year 1, but just want to flag 2 areas of concern, one in relation to our spend on variable pay, and one in relation to our spend on long-term care packages of care. If I can then take you on to page 8, this is our current forecast COVID costs. The board will be familiar with this sort of format based on the reporting that's been done in previous boards. So our current forecast spend in relation to our COVID response is 22 million for this financial year. The usual risks and opportunities are included in page 9. This will be developed as we move through the year. And obviously our focus is on managing the risks, mitigating those risks and crystallising opportunities to deliver our overall financial position. And then the next page, just to flag, is on page 10. This is something that we'll be bringing into the reports, and there's probably a bit of a new item, which is to really keep the emphasis on our underlying financial position and what our current year performance will mean for future years. So as the board will remember, we had a brought forward opening deficit position within our plan, which was in the main in relation to previous years non-delivery of savings, as I've referenced earlier. So this table, which is in the early stages because we're in month 1, will be updated and reported throughout the year, so the board are fully sighted on our underlying position and our financial ask to deliver ongoing financial sustainability. Currently in there is included the assumption of our £1.7 million delivery against savings, as I referenced earlier. That will remain in there and will be removed as and when we deliver those savings recurrently. So I think they're the key things I wanted to flag. as always, happy to take any questions and go into anything in more detail. Thank you.
Thank you, Pete. I mean, we've had so many consecutive years in which we've broken even, which is wonderful. Be great if we can do the same thing at the end of this financial year. Mel.
I was really just going to ask, I'm sort of noticing continuously that we have got sort of under the risks. Our one high risk is going to be around the continuing healthcare. And I was really just going to ask maybe if we could look at that maybe in a board development so we understand that a bit more, because it is quite complex, and the positioning and how that works with us and generally going forward. So really just as a request that we could maybe look at that further in board development at some point would be really useful. I don't know about the other members, but for me anyway. So thank you.
Yes, thanks, Mel.
Yeah, thanks, Mel. I think we can look at either a board development session or including a specific item in our performance and resources committee on that area. So thank you for that comment.
Yes, I bring Carol in next and then Tony.
Thanks very much, Chair. I just wanted to flag a couple of things to emphasise some of the comments that Peter's made. So in relation to page 10, I think it is going to be really important for us to be tracking through now the issue of an underlying brought forward deficit position and the challenge, and we are all very well aware of the difficulties of that impact of COVID being brought through, but particularly because what we don't know as yet is the longer term sort of fiscal policy that is likely to be adopted, how much money we are likely to get or not, and whether there's any likelihood of public sector spending reductions actually or freezing into the longer term. Recognising really the economy has taken an enormous hit in terms of COVID. So I don't want to be full of gloom, but I do want us to be realistic that we've probably got this year to bring into play a lot of our sort of strategic developments that make sure that then we're on a firm footing as we go into the next year, because the potential is that that's going to get a much harder economic backdrop for us. So I just wanted to stress that and welcome that page 10, and of course we will pick it up continuously through the year. Thank you.
That's really important. Thank you, Carol.
Can I come back on that, Chair?
Yeah.
Yeah, so thank you, Carol. Totally agree. And I think this is where our development in the board, introducing our efficiency framework, our whole value-based healthcare approach is really important. That is how we ensure that we use the resources that were allocated most effectively and appropriately. And that's how we'll be able to deliver financial sustainability going forward. So this really is a year of opportunity to really embed that and to deliver against those ambitions and priorities.
Yes, thank you. I always dread that word assumptions that finance directors love, because it covers such a broad spectrum, doesn't it? But thank you very much anyway for that reassurance. Tony, would you like to come in?
Thank you, Chair. I'd like to congratulate Pete and his team and the executive management team on bringing in a balanced budget. In a previous life, when I was a finance director of the County Council, I used to take a much more pessimistic view of financial futures than Pete, but Pete's been proven right ever since he's been here. The one point I'd like to clarify, Carol mentioned the state of the UK economy, which is obviously being heavily overspending. There's either going to be tax increases or pressure on public expenditure, or a combination of both. I think there's a lot of UK sympathy for obvious reasons with particularly the nursing profession and certain offers that have been mentioned on salary increases. If there were to be a significant increase in, I'm using nurses as an example, in public health pay, public health, I'm back in the local authority now, in health, and the position in England would be that there must be restraints. You just cannot continue running a deficit like this, particularly with the type of political control. The consequential of changing those substantial figures could hit or will hit the Welsh Authority if my gloomy position comes home to roost. There's no magic solution within Cardiff because obviously they're entirely relying on parliamentary decisions in London. Are you concerned about this, Pete? Because you can't just keep giving X% every year to the public sector with a massive deficit, which has to be paid for and funded. I'll leave that there, but congratulations on the excellent year-end position.
So thanks, Tony. If I can just come back on the 2 points. First of all, appreciate the positive comments and the thank you. You and the board have heard me say this before, but it is the whole board that deliver the financial position. It's all budget holders, all people that make decisions that commit our resources. So that credit has to be a whole organisational wide. I do recognise the thanks for the team though on their role in reporting our financial position, ensuring that people have the right business intelligence to make the right decisions. So thank you for that, and my thanks to the whole board. In terms of the future outlook, I agree. There is an element of uncertainty at the moment. We can only deal with what we know and what we know around this financial year. And I think the key thing is that we ensure that we maximise the benefit for our population of the resource that we have got. We need to make sure that all our funding, all resources are allocated in terms of the most appropriate place to deliver the best outcomes for our population and to deliver value. And I think if we have that as our means of approach, then we're using the best use of our resources. As and when the challenge is or isn't presented for future years, then we'll be in the best position to respond to that. I can't really comment much further because there is an element of uncertainty in there. Hopefully that helps.
Thanks, Pete.
Thank you. And I know Carol would like to come in as well, please.
Yeah, thank you. Just on pay awards, really, Tony, just to say that the pay review body, I think, are due to report, and there's been quite a lot of interest, obviously, from staff, trade union organisations in this. Depending on what the UK government determine in terms of the NHS, particularly in England, there may be some consequentials that come across to Wales or all devolved administrations on the back of that. So we'll have a look at that. But clearly there may be different policies taken on pay setting across the devolved administrations, which may or may not present then a bit more of a challenge, as you rightly indicate, in terms of Welsh Government budget. So we're keeping a very close eye on that one, Tony.
Just to finish the point, the Welsh Government also, as I understand it, have tax raising powers themselves, which have never to date been used, but it'll be interesting to see how they deal with that.
Yes, very interesting. Thank you, Tony. Thank you again. Early in the new financial year, but excellent presentation. Thank you.
Thank you, Chair. Thank you.
Can we move on then to the annual report on the Nurse Staffing Levels Wales Act 2016, introduced by Kirsty Williams? Well, it only seems yesterday, but it must be about at least more than that, 4 years, 5 years ago even. So, Alison, over to you.
Diolch yn fawr, Chair. Thank you very much indeed. And as you mentioned, this constitutes the annual report for Powys Teaching Health Board. Just to set the context up front for colleagues and others, from a Powys perspective, there are three lenses for us. One is in relation to our provider arm. The other is in relation to the commissioning responsibilities we have in Wales and in England. And the other one relates to potential extension for the Act. So as you've just mentioned, Chair, Nurse Staffing Levels Act originated at Royal Assent in 2016, and the most recent statutory guidance was reviewed in March 2021. and you know the guidance is very specific in terms of its requirements of health boards. For us in Powys, we've got a duty under section 25A, which is an overarching responsibility in relation to the sufficient provision of nurses in all settings in services that we provide or commission. For acute health boards, other health boards in Wales, section 25B and C are applicable. Those are about calculating and maintaining the nurse staffing levels in acute settings, and more latterly paediatrics, and section C relates to the method of calculation and triangulation. As I'm clarifying this as colleagues may see this in other settings. For health boards who provide acute services in those areas, a 3-yearly report was required at this stage, and that wasn't a requirement for us given the services we directly provide. So just to bring attention then also to colleagues in England, where obviously people of Powys experience service provision. There isn't an equivalent law in England, but trusts are expected to comply with the NHS guidance there, the CQC and other requirements. So there is an approach that isn't in statute but is well established there. Just to confirm, for midwifery services, the method of calculation is birth rate plus and is outwith of this guidance. So to take colleagues through the paper, on the bottom of page 4, there's reference to the proposed extension of the Nurse Staffing Levels Act in Wales, and there was the opportunity for Welsh ministers to consider that as part of the original Act. And you'll see there reference to the 5 work streams that are currently established, and they're at varying degrees of maturity in terms of that trajectory that may apply to the extension of the Act. I'm not proposing to go through each of the work streams in detail, but I can pick up any questions later, Chair. In terms of compliance with the Nurse Staffing Levels Act, from a Welsh perspective, all health boards are expected to conform to the reporting requirements in relation to the Act, and reporting is undertaken via board structures within each of the health boards. And from our own perspective, we have an overview in terms of our long-term agreements and clinical quality performance review meetings in relation to compliance with the Act. All health boards have complied with the Act to date in terms of reporting to Welsh Government. That's in the public domain and accessible to us and others in relation to Welsh Health Board's performance. There is a note that nursing establishments have been reviewed across Wales essentially in relation last year in relation to the COVID pandemic, and that process is articulated in each one of those health board reports. In relation to NHS trusts in England, there's a requirement to develop safe care systems, which looks at acuity and dependency and record the amount of staffing required to provide safe care. You'll notice on page 8, Chair, there's particular reference to Shrewsbury and Telford NHS Trust, and that is in response to the Care Qualities Commission previous rating of inadequate staff, and felt important there to demonstrate some of the assurance work undertaken by staff in relation to staffing levels. You'll also notice in the report that the requirement to report was suspended by NHS Improvement during the period of the pandemic. Moving on through the report to page 9, Chair, there's articulation there of Powys Teaching Health Board's response to the Nurse Staffing Levels Act, given section 25B doesn't apply to us because of our provision. And you'll see there a number of examples of the way in which we take an oversight of ward nurse staffing levels. Given the contents of the report, it suggested that the board could take a reasonable level of assurance in terms of nurse staffing, given the context of COVID and the English-Wales differences. In relation to next steps, there's a number of elements there that we are progressing, and you'll see that the internal nurse staffing levels group is recommenced and taking quite a strong overview of our approach internally, as well as our commissioned elements and our contribution to the proposed areas of extension. That's my presentation of the paper, Chair.
Yes, thank you, Alison. And that was a very good, thorough paper and a detailed coverage that you gave. So I don't anticipate many questions because for me, you've covered off most of it. But Ian, you have a question.
Yes, thank you, Chair. Back to page 8, and thank you for highlighting the Shrewsbury and Telford processes that they've got in place for improvement. And I just wanted to know some reassurance really on the mechanisms for monitoring that progress, which I think is perhaps important.
Thank you very much for your question, Ian. And of course, compliance with the requirements in England, not the Welsh law, are one of a number of areas that our quality review meetings concentrate on, and nurse staffing levels is one element of safe and quality care. So those aspects are included within our commissioning assurance frameworks and monitored regularly in that way.
Yeah.
Thank you, Alison.
Thank you, and I understand the paper has already been to a Performance and Resources Committee, so we have had an opportunity already to ask questions, the independent members involved there. But thank you, Ian, for that question. It is important to us. Right, oh, well, I'd like to continue now, please, if possible, because we are falling behind a bit. I don't want anyone to miss out on their opportunity to present podiatry services. So over to you, Claire, and then Peter Taylor as well. So do you want to start?
Yeah, thank you, Chair. Yes, thank you for the opportunity to present the board with an update on podiatry services, particularly following the recommendations of an internal audit review we had in September. I will be quite quick on this because I know we're short of time and I want Peter to have the opportunity to talk to you. So the paper really is in response to the podiatry audit that happened in 2018 and 19, which had an outcome of no assurance. It was then re-audited, as the board will remember, in September 2019 and just had a limited assurance outcome. So we've included all the recommendations in the appendix, and you can see the updates, and we're really pleased to announce that all of the recommendations have been achieved now. As you know, one of the recommendations was that we had better leadership within the podiatry service, and we're therefore delighted that Peter joined us in July. And really a lot of the success of the outcomes is thanks to Peter and his team really grasping the nettle and, you know, really making the improvements that we needed. So Peter will cover off most of those areas. As you'll see in the report, we've covered off all of the improvements that have been made, and we've also done quite a lot of work with both patients and staff. So we really understand the differences that those changes have made, and we are looking to listen and learn as we go along now and make improvements in response to what we hear from both. So I will hand you over to Peter now, who is Head of Podiatry, who will just outline some of the improvements that have made our response to COVID and also our future aspirations.
Thank you. Over to you, Peter.
Thank you, Claire. Thank you, Chair, and thank you for giving me the opportunity to feed back to the board on some of the changes that we've implemented in podiatry. One of the big changes that we've made is around management of the caseload. We had an enormous caseload in podiatry. Some of the patients have been on the caseload for many years. Many of the people on the caseload had never had a contact for 2 years or more. So part of the work that we've done is actually validating the caseload to make sure that everyone that is on the caseload still needs to see us. So that's a big task that was undertaken with the podiatry team and the contact centre. Initially, the podiatrists were doing this themselves during COVID, ringing up the patients, but we had soon found out that there were problems with this, in that there were a large number of patients that we just couldn't get hold of, whether this was because telephone numbers had changed, but in the end we resorted to writing to patients and then acting on that, whether they still needed us or whether they no longer wished to have any contact with the service. We've made big changes to the way that appointments are managed now. So we no longer have the complaints from patients that when they ring on a Monday morning they can't get an appointment anymore. Part of that is the fact that podiatrists now manage the appointments mainly themselves. So if they're giving patients an episode of care, they book the appointments themselves there and then. The contact centres still manage new patients and book those in. But also, as Jamie alluded to earlier, we're moving to the fact that see on symptoms and patient initiated follow-up as well. But part of that is building confidence with the patients so that they know that when they ring us, that they can get an appointment if they've got a problem. Whereas before they would ring up and not be able to get in for weeks. So they were only happy if they actually went out with an appointment. Hopefully that over time will start to improve. All new patients now are assessed and given a risk category, and that helps us to make sure that when a patient does ring up that we can prioritise them correctly and make sure that they're seen within a relevant amount of time. The next thing, the redesigning the service, we've moved now to instead of having the number of sites that we had initially, we've now moved to just having 10 sites. 9 of those sites are actually operational. Huntcliffe at the moment we can't use because of the building work that's going on there, but we're managing to see the majority of patients at other sites across the health board. We've improved the multidisciplinary working outside the health board with some of the neighbouring trusts, working closer with their diabetes multidisciplinary teams to make sure that we can refer patients in to them as necessary, but also that they can refer out to us and the patients are going to be dealt with appropriately. We've improved the working relationship with local district nursing teams. We're doing a lot more joint care with the district nursing teams. Just as an example of that, we've been working with the district nursing team in Llanidloes, and one example will be a patient that was a stroke patient who was an amputee with a chronic heel wound that we've managed to heal that with the district nurses team by doing casting to offload the area so that the wound is now healed after being there for a long period of time. We've also improved our relationship with our referrers as well, in that now we follow up every consultation with a letter so that the referrer then knows what's going on. Hopefully again that'll improve the relationship with referrers so that they can be confident about what's happening in the service. The other aspect of the multidisciplinary working that we're doing is that we've got a member of the team working with the School of Podiatry at Cardiff Metropolitan University, and that's going to help us to build a relationship with the students there and hopefully attract students into the health board to become podiatrists with the health board in future. Acting on feedback from the team and their concerns in dealing with patients who were uncomfortable or unhappy with the changes in the service, we've done quite a lot of professional development with the team, not least in that we've done a team training day on having difficult conversations. So to help them deal with the conversations and make sure that we're dealing with it in the most appropriate way possible. We've also had a diabetic foot update day and a soft casting study day so that the whole team are now more on board with that and can be involved with improving patient care. We're also planning to do extra training on access to prescription only medicines and non-medical prescribing and diagnostic ultrasound. With regard to prescription only medicine access, this is something that podiatrists can do in that they can supply a limited number of prescription only medicines to patients without having to resort to prescription. So hopefully this will help to improve the service we give to patients and introduce a one-stop shop service so that patients don't have to go to the GP or introduce any unnecessary delays in care. We've had quite a lot of positive feedback from patients generally, but we've also done a telephone survey that the contact centre conducted for us, and they took a random sample of 25 new patients and did a telephone survey with the patients. We had a 78% success rate with the call, so that was actually quite positive, and the results were generally positive. The results of that survey are in the board paper. We've also had quite a lot of feedback from the podiatrists. Some of this was on the back of comments that we'd received, but also we've the fact that we've actually moved on to electronic records, which has made quite a big difference to the service. And again, that helps us to improve patient care, in that when patients ring up, we no longer have to refer to paper records, which can cause delays. We can actually see the results of any interventions immediately and make sure that we can address the patient's concerns sooner rather than later. For the future, we want to build on the work that we're already doing and the neighbouring trusts, and actually improve our relationships with the MSK services in trusts in the neighbouring health trusts, so that we can offer a wider range of services within podiatry, particularly around things like soft tissue injections and joint injections. We're going to try and develop our use of diagnostic ultrasound, again for MSK, but also to help improve the services that we can give to patients within the health board. We plan to undertake training for practice nurses and healthcare assistants to improve the standard of referrals into the service and ultimately improve patient care. Also want to introduce a mystery shopper into the service to try and get some independent feedback on the service and the services we provide. And we also want to extend the patient survey to look at different aspects of the service, and also to make sure that that's an ongoing thing so that we can continue to learn. Happy to answer any questions.
That's great. Thank you ever so much. What a turnaround. Marvellous. A lot of hard work has gone into that. Matthew Dorrance has a question, and I know Carol wants to come in. So, yeah, please go ahead, Matthew.
Thanks, Chair, and thanks, Peter, for the presentation. It is great to see the progress that you've made in a really short period of time. So congratulations to you and your service area for that. My question is more around diabetic foot care in podiatry in particular, and just I'm not really sure of what the pathway or expectation is in terms of patients for treatment in relation to diabetic foot care in particular. More recently, I've become aware of concerns from residents. I'm a counsellor, so that's usually what happens when things don't happen. They contact politicians. People who received diabetic foot care previously now unable to receive that from the health board, and having to pay privately for that. Now, in the context of the socio-economic duty that we've got as a health board, and balancing that with prudent healthcare, on the surface it looks as if prudent healthcare means stopping to deliver services. Now, I know that's not what it is, but that's what it looks like when you just take a small view of it. And I just wondered if you could outline, maybe very briefly or in another conversation with me, what the pathway is and what people can expect, and how you decide not to provide diabetic foot care, and in particular toenail cutting services. Thank you.
All of the patients, as I said, are given a risk category, and part of that is through NICE guidance. But what we're trying to do across the board is involve patients and their families or carers more in their care. So because of the risk categorisation, we can have a good idea of what the patients actually need from the service. If someone's identified as being at high risk, they may not need regular ongoing appointments, but they have the ability to access the service whenever they like. But if somebody's low risk and it is just normal social nail care that they would normally be able to do for themselves, then we help them to do that for themselves. If they want to go privately or access the third sector, then they are open to do that. We also have patients also have the ability that because we've got an open referral system, if ever they have concerns at any point during their care, they can always come back even if they have been discharged. Does that answer the question?
That's helpful, Peter. Yes, thank you.
Thank you very much. Carol, if you want to come in, and then Mark quickly.
Just a very brief comment from me. I think this is good practice that we will want to replicate in terms of bringing back reports where we have undertaken engagement and consultation, and then people can see the results of the changes. Because I recognise that there was an engagement consultation happened with the CHC partners and obviously the public, and we were consulting on modernising this service, and I think today we can see the results of the changes that have happened. So I think it's a good way of doing it, and hopefully we can adopt this as a normal part of our practice. Thank you.
Thank you, Carol. Mark.
Thank you, Chair. Yeah, very quickly, just support what has been said in a positive sense. It's very, very pleasing to see how it's moved on. Just in terms of picking up one point is the number of multiple chair clinics and what's going to happen and how you're going to take that forward if it's going to be to look to increase them.
Yeah, I mean, that's a big problem, really, particularly in the north of the Health Board. One of our busiest clinics is Park Street, and we've got a single chair there, and it's been really difficult to try and get extra accommodation. Recent meetings I've had with the property group have suggested that we look at maybe getting a mobile unit, which maybe help to address that, but it could also address access in other areas as well. So that's something that we'll be looking at. But long term, accommodation, particularly multi-chair clinics, is an issue across the Health Board.
Thank you very much. I think we'll just have to pick that up as a board and see what we can do to support you. Thank you.
Thank you, and thank you again, Peter. That was excellent. Claire, do you want to come back?
No, just to say it's a real pleasure to bring a report like this to board, where we can actually see that we've had the opportunity to address the issues highlighted by the internal audit, which have been really useful, and also to act on the learning we've had from both feedback from patients and staff.
Thank you. Thank you very much, and thank you again, Peter. We have to move on now to the assurance reports. I don't know whether you want to come in quickly on that, Rani, or whether we can just get on with them.
Chair, I was just going to suggest that given time, we take them as read, the remaining reports as read, other than where there is a need to escalate anything for board attention, if that's okay.
Yes, that's fine. I mean, I can see in Carol's report there is a very important key item. So if we take the executive report first, Carol, is there anything you'd like to draw to our attention there?
Yes, thanks very much. Hopefully the report was helpful to board members, but I would want to just ask board members for an endorsement of a decision that we made. So on page 403 of your pack, this is an item that relates to a relocation of NHS general dental services from Llanfyllin to Llansanfraid. A lot of discussion about this at the executive committee, and further interaction with the Community Health Council, and thanks to JB and Hayley for engaging with the CHC on this. And thanks, Andrea, to the CHC for finding the time to discuss this matter. I hope that the report gives the explanation as to why we were looking to make an urgent and permanent service change under the regulations. We have made the decision as a committee to support this approach in trying to ensure that access to dental care maximised in an area where we know there are access difficulties, and so we're asking the board to endorse the decision of the executive committee to proceed, and I can confirm that the Community Health Council have confirmed their support.
Oh, thank you, Carol. That's important, that last point. Are we all prepared to do this, or are there any questions before we go ahead and ratify? No? Everyone happy then? Thank you very much. Thank you.
Nothing else to add, Chair.
Right, thank you. Thank you, Trish, for placing that in the chat bar. Right, so the other reports are self-evident. If there is any particular issue that anyone would like to raise from those, please do so. Now is your chance. Otherwise, can we take them as read, please? Thank you. Thank you very much. I'd like to bring Andrea Blaney in now. Thank you very much for attending this meeting, Andrea. I know both Katie and Francis had difficulties, so we're really grateful to you.
Diolch, thank you, Chair. Prynhawn da pawb. Good afternoon, everyone. Thank you for the opportunity to introduce the Community Health Council report. I'd just like to highlight a few things in the report. Our staff are still working from home in the main. Our members are not carrying out visiting activities or engagement activities in person at the moment. So our main way of engaging with the public continues to be digitally through social media channels and via attendance at virtual meetings. We're pleased to report that members of the public are still joining our meetings, and they have opportunity to ask questions in the meetings. Following on from our full council meeting in March, when we had a focus on mental health, we're actually in the process of developing a survey to gather the views of young people about their experience of accessing mental health and emotional wellbeing services. We've been in contact with schools about circulating the online survey through them, and they're happy to do that for us. We'd hope to be able to get the survey into schools before half term, but it's still with translation at the moment, so it's likely to be the first week that they're back in school now. The recent service changes which have been considered by CHC, as mentioned earlier in the meeting today, was vascular services. Just to reiterate that the CHC decision to agree the proposals on that was not conditional on the points of observation that we made. Those observations were merely matters to be considered to mitigate the impact on Powys residents. Regarding our concerns that all the spokes are along the M4 corridor, the CHC would support the Health Board in discussions around a spoke being situated at Prince Charles Hospital. Last week, we agreed the engagement plan for the proposals to change radiotherapy services in South East Wales, which include the development of satellite radiotherapy centre at Neville Hall Hospital, and the engagement commenced on the 20th of May. And then, as just mentioned, we also agreed the proposed urgent change of location of the Llanfyllin dental practice from Llanfyllin to Llansan Fried. We requested that there be detailed communication with the wider community rather than just with patients of the practice, and that for any issues highlighted by members of the public, a mitigation plan be put in place, and we would hope to have an update in about 6 months' time on the impact of any changes. On podiatry, it's really good to hear what we've just heard about the improvements following the engagement last year, and as a CHC we would welcome an update at a meeting. On advocacy, over the last month we've started to see a slight rise in the number of people who are contacting our complaints advocacy service, but there are no particular trends to report on that at the moment. and we look forward to working closely with the Health Board over the reinstatement of services as we move out of the pandemic. And we continue to stress the importance of early discussions with the CHC if it looks as though there might need to be any changes in services. Finally, we extend our continued thanks to all staff and volunteers for the incredible work in rolling out the vaccination programme. And we're also very grateful for the ongoing weekly contact between the CHC and the Health Board, which allows us to discuss and resolve any issues as soon as possible. And I'm happy to take any questions on Katie's report. Thank you very much.
Thank you very much, Andrea. Does anyone have any questions? It's very clear. Oh, Mel, yes, please.
It's not a question, it's just a request really that I'm just really interested in the work you're going to be doing with the school-aged children throughout Powys, and really welcome seeing that report once it's done and you've got the results. It sounds really interesting. So I'll just say thank you on that one.
Of course, thank you, yes.
Thank you, Andrea, very much indeed. And could we then, oh Trish, you've got a comment as well.
Just to say thank you for such a clear report and for the work that you do, and it is greatly appreciated by us.
Thank you, Trish.
Thank you very much, Andrea.
Thank you.
We turn now to the assurance reports on partnership arrangements. Carol, is there anything you wanted to particularly draw out in any of these?
Thank you very much, Chair. Not particularly, but just to recommend that those colleagues who do want to take a closer look at the detail of some of the joint committees and partnerships, there is more detail available either publicly or if you wish to come through to my office, that is available. There is a lot of work that is going on through the WISC and through EASC, as well as shared services and other committees that we participate in. So I don't want to brush over any of that, but to give board members an opportunity to come back on any of the things that they read. There is a Audit Wales report on WISC, which I think is worth reading. And then just on the issue of partnership arrangements, if I can just indicate that I will be stepping down as the Regional Partnership Board Chair, hopefully tomorrow, more formally, which is to be my last meeting as Chair, and be handing that over. But I will continue as the Chair of the CROG, as Carl referenced it earlier, which is the Cross-Cutting Resources and Oversight Group. And we do hope that we can bring through much more in terms of the partnership developments. I think we managed to do that today with the Workforce Futures item, but to make sure we've got a good flow of other partnership developments. So I just wanted to raise that, Chair, if that's okay.
Yes, thank you. Did anyone else have a question or a comment? Thank you. I did pick out the EMIRTs, the Fire and Rescue Services as potential first responders. Quite interesting to see a fire engine turning up outside somebody's house, but fascinating to see developments there. Is there anything else? No? So I don't know, Susan, if you wanted to respond to anything or question anything in relation to the partnership, local partnership forum. Perhaps I was looking in the wrong column. Okay, thank you. Well, I think in that case, if everyone's content, that concludes the meeting. Thank you.
Thank you very much.
Thank you, Chair.